what is an scoliosis? A scoliosis is just in a normal curve, and it's going to be a lateral deviation of the spine, okay? This is the right scoliosis, C scoliosis, and that would be a left C scoliosis, okay? You also can have an S scoliosis, and S scoliosis will involve the lumbar spine as well as the thoracic spine and the cervical. Why? Because you cannot be like this. So the eyes have to be straight. So your head is going to try to move forward, normal, because the right reflex, okay? Then what happens and how we as chiropractor, Dr. Chiropractic, could help with the scoliosis. Basically, we really worry about the rotation. There's a lot of rotation. The spinals go inside, inward, and the TPs go outward. So if I ask my patient to lie down, facing down, prone, and I do my palpation, okay, static palpation or motion palpation, seated, then mostly the patient is going to be tender on the joint here where the ribs attach to the TPs, to the transverse process. Also, a lot of people are tender in the front because the ribs come here and attach to the sternum, okay? And then we palpate, or I palpate, and there's also sometimes tenderness here. Even sometimes the manubrium or the sternum or the joint here, the angulus luis, is deformed, okay? Because the patient has some deformity when the scoliosis is really bad, okay? 10% is considered, 10% deviation is considered a scoliosis. But some people go even farther, 20, 30, 40, 50. When someone gets to 50, between 50 to 70, then it's considered a refer to the surgeon, okay? According to the studies, the person could danger the organs, and they may start suffering from respiratory issues, okay? Kids and adults. All right, so we're going to keep going. And there is different type of scoliosis, and the question is, why do we have scoliosis? Number one is having to be idiopathic, meaning we don't know in medicine. There's controversy on that, and some theories said that the bones grow too fast or not normal. Other theories said that the spinal cord is maybe deformed or too short, and that pressure will create that scoliosis, okay? Then the second thing would be congenital. Congenital is a big one because some people are born with this bone, the pelvis bone, shorter than the other bone. And of course, it's going to be some misalignment there. It's going to be some malposition. It's going to be some muscle imbalance. And then the lumbar spine and the whole spine will compensate to that. Second thing would be also hemivertebrae. That would be a hemipelvis. That would be a hemivertebra. Meaning the vertebra is not totally symmetrical. It's not, actually it's maybe shorter in one side than the other one. And the bones also going to compensate into that. Third thing would be some people who are born with no spinals, okay? They have no spinals, they call it spina bifida. It may create also scoliosis, okay? Third thing would be biomechanics. That's a big one. And I, as a Dr. Chiropractic, really can help with this, okay? Biomechanics mean, for example, number one, some people may develop hernias, okay? Then when you have hernias, then it's a lot of pain. You tend to move away from the hernia, and that could create scoliosis, okay? Second thing could be fractures, some old fractures that people have. I'm talking about the joint, the legs in this case, okay? I have fractured before when I was a child, and give me a lot of issues and create an anatomical short leg, okay? That will create scoliosis because my leg is short, and then now my pelvis is like this, all right? And then I develop some back pain issues. Other thing that you could have is other, for example, compression fracture may create a little bit of kyphosis and also scoliosis, okay? Perhaps if you have other pathologies, but muscle imbalance would be a big one. Bad posture, okay, developing bad posture when you're in your childhood, all this could actually make us to produce or create or provoke a scoliosis. If you have your knees valgus, your knees inside like this, let me see, something like this, people who got the knees like that, that will maybe create a scoliosis. Pes planos, person who got pes planos may also create scoliosis because the overpronation of the foot, and the whole spine going to compensate with that. All right. Then, so how we diagnose that? How do I diagnose that as a chiropractor? I do take X-rays. I do some orthopedic testing, muscle testing, and orthopedic testing to recreate the pain. I do some neuro testing. I will do the muscle testing for the motor nerve and the sensory testing for the sensory nerve, okay, to see is more sensation, less sensation, to see what happened and if any damage to the nerve, okay. From there, I may do some range of motion, you know, active and passive, and then from then I may decide, diagnose, and go ahead and treat. Treatment, number one, we go to the spine, okay. If there is some pelvic issues, then we would like to fix that, all right, to help with the scoliosis. Also the rotation of the ribs, maybe a subluxation, malposition, a distort rib, and then we try to decrease that, diminish the pressure on the nerve. And sometimes there is a lot of pain going to the front because the intercostal nerve create intercostal neuralgia, and then we can be really powerful, or I can do really well moving and easing the pain with adjustment, manipulations, stretching, exercising, and everything else. We also add the physiotherapy, physio rehab, or physio modalities, okay? We use some equipments like laser, ultrasound, definitely ice and heat, okay? Perhaps I use some taping, all right? And then stretching, like I said before, and exercise. Okay, the diet has to be involved in this. Diet is important. If you're eating too inflammatory, you have to decrease that, okay? A little less sugar, a little less salt, a little less white flour. That definitely will help you with the inflammation process. You don't want to have inflammation right there. You already have a lot of rotation and deviation to the side, so you don't want more inflammation right there. Exercising and lifestyle. You gotta exercise. You gotta exercise. It's gonna be good for you. Remember, you have to participate in this healing process and start exercising and eating better, okay? That definitely will help you. But the adjustment, the chiropractic adjustment, is powerful. That manipulation, that stretching, that treatment right there in the area is gonna make you ease the pain, decrease the stress on the nerve system, help with the draining, help with the circulation. All that is gonna be good for you, all right? So this is Dr. Carrazana. Remember, if you like the video, you can give it a like, subscribe to my video, and remember, with the techniques I use, you will never lose. Have a good one. Bye now.